Good morning, ladies and gentlemen. I'm Lee, this is Adriana. We're doing a little cool sculpt on Adriana. This is her, you said your second treatment? Second treatment, so she's trying to get that body ready for the summer. So what we're doing is we're gonna do, her main area that she wants to focus on is the abdomen. She did talk about the love handles, but today we're gonna be focusing here on the flat part here. Now, what I did is I already marked her ahead of time on what we're gonna do. So we're gonna do one applicator, but we're gonna go 4 times around. So one here, 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 and then over here. And that'll basically cover this general area right here. Each time we go around, it's 35 minutes per spot. So she'll be here hanging out. We do have like TV, so she can watch TV while she's hanging out, or she can take a nap if she wants to. We put the lights out. If she doesn't want to Netflix and chill, she's gonna just chill and go to sleep. So what I'm doing right now is wiping her abdomen down here with a little wipey. So this has a little skin protectant in it and also helps clean up the area. So now that I've got her all wiped down that spot, what I'm going to apply next is the gel pad. With the gel pad, what the gel pad is going to do is going to protect her skin, from the cold. So this, whatever's in the wipe, actually, I forgot what it's called, but I think it's propylene glycol, I believe, is also on the sticky pad itself to help protect the skin. So a lot of patients are concerned about frostbite, and with this, it's actually a controlled environment, so there's really no risk of it. I mean, there is the risk of it, but we've actually never really seen it. All right, so next is telling me to put my filter on there, put the gel on the patient, clean them up, and then this is our head here that we're going to be using. So Adriana's gonna feel a little suction here, and what happens is the area that I marked will be sucked into this cup here. And when we're done, when I pull it off, you'll probably see like the little lines on her when we're done. There we go, a little suction. All right. What Adriana is going to experience is, of course, suction here, and then it'll get a little tingly. Sometimes with the tingling sensation, it's going to feel like it's burning. And what I like to tell patients all the time with starting it and actually taking it off and doing massage, which we'll do later, it feels like that, when you're in the ice chest looking for that drink that you really want and you're like searching and searching and then your hand goes numb, it starts to burn and you go numb. It's the same sensation that she'll be feeling too. When I take off the device and do the massage, it's going to be the same sensation as well. It's going to feel like it's burning, and then it starts to feel a little bit better. So Adriana is going to be here for 34 minutes. So we'll get back to her, see how she's doing in a little bit, and then we'll get ready for the massage once we're all done with this session.
Okay, Adriana, how are you feeling?
It actually just feels cold. It's starting to feel a little tingly, like Lee said. Not bad. I have had it done before, and since COVID and working so much and not being able to go to the gym, I did gain a little bit of weight. So I think this will be a good thing right before summer, because I do like to go to the lake. I like to hang out in a bathing suit. So my problem area has always been around the belly button. I have 2 kids, so it's nice to be able to do a treatment that has no downtime, really. When I had it done before, I went to the gym right after I had it done, and I had a little bit of soreness, but it was really easy.
Okay, and then what are you most excited to wear after you get the results from this treatment?
Oh my gosh, bathing suits. And not feeling like I need to lose weight again.
All right, so Adriana is done with the first cycle here. So what I'm doing now is just unstrapping it from her body, and I'm going to turn the suction off, and then I'm going to pull it right off, and I'm going to have you, it makes a nice sound when you pop it off. We'll have you take a look here. So if you take a look at it, the inside of the cup had that lining right there, those little lines that went across this way, and you can see that it made great contact, and it's perfect right in the area where I wanted it to be. So what I'm going to do now is I'm going to start massaging her abdomen, and this part some patients like, some patients don't like. It can be uncomfortable at first. Kind of, if you're ticklish, you'll probably start laughing. So this is basically like a little 2-minute massage, and it's not a nice massage where it's like a relaxing massage in a spa. This is where you really want to squeeze in the area and make sure that we break up the frozen fat cells so that the body can break it down. Well, the massage is necessary because when they were teaching us at the little CoolSculpting University, they showed us one side that's being massaged and the other side And the one side that had the massage actually had better result than actually just leaving it. So how does it feel, Adriana?
Fine.
So see, Adriana is a perfect example of how some patients actually are fine without it. If you had me in the chair, I guarantee you I will start laughing and squirming and sliding at least halfway down the chair. So
That was me before. It was really ticklish. I actually feel like my stomach's a little numb. I just feel the borders.
yeah, a little bit. So we're just gonna keep on going and going and going. You know, everybody has a different reaction to the massage. Some patients can't stand it and they have to tell you to stop, and I tell them I can't. It's better if we just keep going and just get through it. I have to remind myself to breathe when I get mine done. All right, you ready for this next one, my friend?
Ready or not, here it comes.